Hello, good evening.
Good evening.
Right.
Good evening.
Fine. That's the female voice there. I like it. All right. So welcome back. We can't wait any longer for those who have not joined. We are committed to completing this program by next week, and we have to take our time seriously. All right. So we are going to take off from where we left off the last time. And as usual, if there's anything anybody wants some clarification, you have a minute to bring it up. If there's anybody with any question or any challenge on previous discussions, you're allowed to bring it up for review. Otherwise, we move on. And today we're going to look at sperm motility evaluation. You know that the analysis, semen analysis involves a lot of parameters. And so motility is one of the key parameters. Remember in previous discussions, you were told that when it comes to the quality of semen, it does not necessarily depend on the numbers. You can have sperm count with normal values, or you can have numerous counts. If that same count records a high number of dead sperms, then it can as well be described as a poor specimen. Right. So motility is a very critical parameter to look at. Right. So it refers to the ability of the sperm to move and to swim effectively. All right. There should be that element of movement and swiftness. All right. Now, it is considered the single most important measure of semen quality. This is what I was just talking about. When you are talking about quality, motility comes first, because if you have many sperms and they cannot be able to move to reach where the egg is, then they are of no use. So even if a man has a high sperm count and the sperm have reduced motility, it can greatly reduce the fertility potential. All right. However, the velocity of motile spermatozoa is temperature dependent. I think we've said this severally, that temperature is one of the key things that can also affect sperm motility, to the extent that during our preparation for the sampling, you are advised to also counsel your patient to try to get the specimen under certain temperature controls. All right. And it is said that the specimen can be kept in your pocket, close to the body. If you have a jacket, put the jacket on and put it on, just to keep it as warm as it is. I've shared situations with you where you know that normally the women who usually may bring the samples to a lab, even though they're supposed to have been brought by the man, but for very common reasons, you see that the woman who put the pressure on the man. Once the sample is collected, the woman who will bring it, and most of the time, sometimes the woman will bring it and put the sample under the breast, because they have been told to keep the sample close to the body. All right, so that is how far it is, and so the temperature is very important in the motility. All right. So samples that are exposed, once the sample is removed from the body at 37 degrees, if you just keep it at room temperature, room temperature could be somewhere around 25 and thereabout. All right. But in most labs, you have air conditions with temperatures below 20 degrees. So if you just take the sample from 37, then put it at room temperature, or for that matter, air-conditioned environment, that sharp decrease in temperature is what we call a cold shock. Cold shock is where there's a sudden decrease in temperature that affects the activity of any living cell. All right. So it is important to note that. It is therefore essential to stabilize the temperature during motility assessment. We are going to look at how to assess the motility, and we are talking about temperature. And he's saying that if you're talking about temperature difference, one of the things they affect most is the motility. All right. So in order to give a fair assessment of the motility, you should be able to do temperature control mechanisms. And that is, what do you do to avert that kind of variation in the temperatures? Once the sample has been removed from the body at 37 degrees, how do you maintain that at 37? Or at best, keep it in a certain allowable temperature range? How do you do that? I remember I've told you that if you want to do your semen analysis properly and in accordance with WHO standards, you should have a warmer plate. All right. A warmer plate where the plate can be controlled to 37 degrees to the extent that the slice that you're going to use, the cover slips, the saline, everything that you're going to use, including the sample itself, should put on the warmer so that they are all maintained at 37 degrees. This means that the sample is not, and for that matter, the experiment is not going to experience any variation in temperatures. All right. So if the sample has poor motility, it is a real representation of the situation from the body. So you don't want a situation where, let me go back a little bit. You know that when people are coming to take the specimen, you advise them not to do certain things. Why? Because those things you advise them not to do have an impact on the quality of the specimen. All right. So therefore, if you know that the temperature variation can have an impact on motility, and you two don't do anything about it, and then you just write the report and then indicate that it's low, you have not been fair to the patient. Okay. You have not been, because the low motility is not from the patients because of the environmental circumstance. So it is you as a scientist working on the sample to try to mitigate any temperature variations as much as possible. Okay, as much as possible. So I've said over and over again that as you go through the program, you may be doing the semen analysis already. You can improve on it, all right, by trying to incorporate some of the things that we're talking about. Those who have not started at all, it means that you must also make effort to do what we are telling you so that your results will always be very, very credible, reliable, and of the highest quality. Okay, all right. So we said that once you have a warmer plate at 7 and you're putting on your slice and everything, including a sample on it, what you are reducing the risk of cold shock. And I've explained already what is cold shock. All right. Good. So I'm going to introduce you to something which a lot of people don't know about. All right. And it is not part of semen analysis per se. Remember, I've said I'm taking you through a lot of things. Some of them is just to help you to understand the whole concept of the semen analysis. They may not be exactly part of the things you have to do. But some of them too, once you understand them and you want to incorporate them, that's also good. So we're going to introduce you to what we call the wave motion. Wave motion is not a parameter for assessment in semen analysis. Take note, it is not, but it is a stage or it is a step that will help you to have a fair idea about the sample that you are going to work on. Okay, especially with respect to motility. So wave motion is a fundamental characteristic of the sperm motility. What it means is that once something is moving, we know that if you those of us who grew up in the village and we went about fishing with a hook and line, all right. Sometimes you get to the riverside and then you haven't seen any fish, but you see a certain kind of motion on the surface of the river, you know that there's fish in there, because if there's no fish, the fish in there under the water is moving, okay, and its movement is creating certain waves that becomes visible on the surface. All right. So, and you know that sperms move. So once they move and it's in a fluid environment, it should create some kind of wave. Okay, it should, and all of us know a wave where you have that kind of heavy kind of movement. All right. So that is called wave motion, and it is a characteristic of sperm motility. So I want to, as we move along, I will introduce you to how we do it in the lab and how it also helps you to get a fair knowledge about your motility. So that once you have done your wave motion test, if you do your motility or you do your sperm count, and it is also give you a different story, you should know that something is wrong somewhere along the line. So it's like also those people who go for the gram say, they go and do what they call sampling. They go and take a certain aspect. They take some small aspect of soil, do some, and then they have an idea whether there's enough gold in there, so that if per a sample they see that that place is not rich, they will not waste their resources or their time on that place. But they do that small sampling and have an idea that, oh, this place is rich, and then they can put in all the effort, so that at the end of the day, if their sample, what they get from the sample does not tally with what they are getting, then there's a question mark somewhere. Okay, so that is the wave motion is like a sample of a sort, and it is based on the movement of sperms. All right. Now, however, I've always said that to be able to understand any concept very well, you have to take it from what you already know to what you don't know. Okay. That's why sometimes I give examples like what I've just said about the gold sampling and also about Riverside. All right. So, still coming to the wave motion. Now, if you are, say, by the riverside, or these days people have fish pond, all right, then you haven't seen the fish, but you are setting certain waves on the surface. All right. You haven't seen the fish, right? If the waves that you are seeing is so intense, what does it tell you? You are seeing some waves, but the wave that you are seeing is very intense. You're also seeing some waves somewhere which is not very intense. What does it tell you?
There are a lot of fish are there.
Thank you. So it doesn't say that, it doesn't talk about one or two, but you see the movement, the intensity of the movement will tell you whether you have so many fish there or little fish there. So the wave motion, the intensity of the move motion will tell you that, oh, this place there's likely to be fish. There's also some waves here, but the wave there is just very light wave. So if the light wave, probably just some two or three fish which is down there, where you are getting the intense motion, it means that there's a lot of fish there. Okay, so that is exactly the situation. So the wave motion is not about talking about a sperm, it's talking about mass. All right, I mean, a collective movement. It's the collective movement that is giving you the wave. So it is also called the mass sperm motility. I just want you to understand these things very, very well. So wave motion is also called mass sperm motility. All right. So it does not describe the movement of one or two. All right. So once you have seen the movement, it is actually a reflection of a mass movement. All right, for mass movement. So that's why it is also called the mass sperm motility. It's different from total motility. When we get there, I also explain to you. But mass sperm motility is what is described as the wave motion. All right, and it's a collective movement of a population of sperms rather than an individual, excuse me, rather than individual sperm. Okay, right. So, like wave motion in semen analysis is a subjective evaluation. Subjective is like the one that you described. even what is intense, because like we're talking about the fish pond. What somebody will see as intense, somebody will see, oh, but this one is not intense. So it's subjective, depends on whoever is also examining the motion. All right. So it actually it's a subjective um, uh, uh, evaluation. All right. But it is good to give you a fair idea. So as we move along, you see that the movement can also be scaled or graded. Okay, there could be some little movement, some more little movement, and then that kind of grade, that grading. So we take you through that. And I'm saying that all this thing is just a presumptive kind of thing to have, and it's very quick. And as we do that, as you go into how the test is done, you see it very, very quick. You can do it in less than a minute to give you an idea about what you're expecting. And I'm saying so because sometimes you even I'll ask one of your colleagues to do it. You quickly will have to do your wave motion test. And when you come back and you look at the reporters, this was, are you sure about this? Also, can we do this thing again? Just you have seen so because of you just took 1 minute to do that rapid wave motion test. And so you should have a fair idea about what you expect. So if what you expect is not what is actually being done, or you are actually being produced, then you have a cause to also repeat or to question what has been done. So wave motion in semen analysis refers to a subjective and rapid evaluation of the sperm quality by observing the collective movement, as we said. Now, how do we do it? Now, the waves is also sometimes called whirlpools. I'm sure you know about whirlpools, where if you drop let's say a stone into water, you see that it forms like what do you call it? Some rings would begin to create, and then they spread out to get the waves. So that's a whirlpool. All right. So the waves can also appear in that form. So what is a wave motion test? That's the steps to perform a wave motion test. It is performed by placing just a small drop of the specimen. Of course, the specimen ought to have been liquefied and should be undiluted. You don't add anything. And should, of course, be well mixed. And you know why it should be liquefied. You should also know why it should be well mixed. Okay. And then you put it on a clean, pre-warmed microscope slide without a cover slip. So just a drop of the specimen on the cover, so without a cover slip on the slide. And the slide, you say, should be pre-warmed. Why? Because you've said over and over again that one of the key things that affect sperm motility is variation in temperatures. Once the sample is warm and the slide is cold in cold, not cold as in coming from the fridge, but at least in relation to the specimen is cold. Straight away, as soon as we put the specimen on, the motility will drop. You may not see it, but motility will drop. All right. So once the slide that you're going to use is also pre-warmed, it's also placed on 37, and then it's just around the same temperature as the sample. It means that we are ruling out any tendency of temperature causing any defect on the motility. All right. So you put a drop there, and then you don't apply any cover slip. And we said over and over again that here it is important that both the sample and the slice you are going to use ought to have been kept around 37 degrees. Okay. Now, visual observation. So you have done that. What do you do? So what you do is that you use the low magnification. And low magnification, we know that you can use the times 10, and you can also use the times 4. Times 4 is, people don't usually use it in the lab, but it is also useful in some of these things. So, but if you have a microscope, it doesn't have times 4, don't worry. Because what I know is that a lot of people, because they don't use a transfer, they even sometimes just take it off. So that it doesn't have a transfer. That is actually the situation on the ground. So if you don't have a transfer, you have the times 10. That's okay. All right. So you use the times 10 if that's what you have, and then examine the drop. Remember that this drop doesn't have a cover slip. And so if you don't take care, by the time you say jack, as you lower your objective, it can hit the drop and mess up. And you know that one of the let's say advantages of applying a cover slip on a wet mount is that the cover slip will prevent inadvertent touch or contamination of the objective lens with the specimen. I hope that you know that already. So once this one, we are not going to apply any cover slip. If you don't take care, by the time you say jack, you have hit the drop already. Now, to examine the waves, you are using the times and also looking at the edge of the drop, not the middle of the drop. Once you have the drop, of course, to have a middle, to have an edge. I'm sure you know this. So you are going to concentrate at the edge of the drop, and you are going to see that kind of waves. All right. You are going to see that wave-like motion there. And the intensity is what you record. You are not recording as part of your report for semen analysis. So I've said that the wave motion is not part of the parameters that you're going to record, but it's just for your own guide. Okay, so you lower the objective lens and then examine the drop around the edge, and you are going to observe the waves. And the intensity of the waves is what you record. So if you have strong or intense waves, then you scale it. All right. So how is the assessment done? Now, the wave motion, in wave motion, so we are going to see how we assess the motion. And then this is a general statement. Now, in wave motion, the movement of particles is dependent on the number of particles present. Is that all right? Like the narration that we did. If you see by the fish pond side, and then you see some waves where it is strong, it means that there are likely to be more fishes down there than small. So the number of particles will represent or will show the degree of the waves. So that's the first thing. So therefore, if you have a sample with a high concentration, for that matter, the concentration here is the numbers or sperm count. Let me go by the slide so you saw that. So if the sperm concentration is decreased, what do you expect? Will you expect an increased wave or a decreased wave?
Decreased wave.
Decreased wave.
Decreased wave.
Decrease. And similarly, if you see an increased wave, what does it mean? It means that sperm concentration is high. Okay, so you will see that the wave motion test is giving you an idea about two parameters. What are they? The intensity of the wave is giving you an idea about two parameters. What are they?
The concentration of the sperm.
Either the concentration of the sperm increase or decrease.
I'm saying that if you do the wave
motility
and motility straight away. So it is a combination of two things that you are seeing at a go. It will give you an idea about, because remember we said that you can have the high numbers, but low motility. Okay, you can have a high numbers and low motility. But if you're having intense motility, then straight away you are convinced that you have the numbers. And at the same time, you're also convinced that you also have an excellent motility. Otherwise, it's going to be slow. You are going to see some small waves. If you see small waves and then at the end of the day, the sperm count is normal, then it means that your motility was low. Otherwise, you can't get low waves and then also get normal motility and then normal sperm count. It can't happen. It can't happen. All right. So it is like checks and balances for you. Okay. It's like checks and balances. And that is something that if you do labs, it just gives you. And then some of these things is like how do you call it? It could be theoretical although, but it's also something that you can practice. Once you do it all the time, anytime you get a sample, that's the first thing you even do. Once the sample has liquefied, you do it. So it gives you a fair idea about what to expect. Okay. So the assessment, the wave motion is subjective, like I've said already. Subjective means that depends on who is looking at it. The subjective and is rated or scored based on the strength of the waves observed. And the scoring is from 0 to 5. 0 is that you are not seeing any movement at all. So if you are not seeing any movement at all, you give it 0. And I'm saying that it is not part of the record for semen analysis. So you don't say that wave motion 0 or 1 or 2. No, it's for your own like self or internal assessment of a sort. Okay, so you do the scoring. If it's 0, absence or no motion. So in that case, either you have some few sperm cells that are all dead, or there are even no sperms at all. Okay, so that's absence or no motion. Then up to 5. So 0, 1, 2, 3, 4, up to 5. So 5, it means that you have numerous and intense rapid waves. Okay, so the intensity of the wave is subjective with higher scores such as 4 or 5, giving you, suggesting that you have a very good quality semen and then better motion, indicating that sperm, in that case, straight away, you can know that this person is likely to get a good quality report. Okay, right. So that is it. So when you say it is qualitative, something is qualitative, it means that it's either positive or negative, high or low, that kind of thing. That's qualitative. So it is still qualitative, but it gives a good measure of both sperm concentration and overall sperm motility, with indication of sperm's fertilizing capacity. So that once, if let's say somebody you just want to have a little idea, you do your wave motion test. Then so I'm not even interested in the counter. I'm not interested in even the semen analysis. What I've seen is enough. It's okay. If you just want to have a fair idea about what it's likely to do. So that small test that you do within 1 minute will give you a fair idea, and then you move on. Okay, right. So what is the benefit? Why is it important to do it? It has a predictive power, like I've said over and over again. Predictive power, it means that you can use it to predict that whether it is a good sample that doesn't give indication that the person has infertility. Okay, right. So it is a simple indicator for that. Is if you don't even want to do the test analysis, that alone will give you that kind of indication that everything is okay. That is rapid, inexpensive assessment tool. Yosef Yani. All right, so it is a rapid and inexpensive, like we know. Even if you haven't done so before, from what you are saying, you know that it's going to be very rapid and so inexpensive. You don't need anything. You don't need anything to do. So it provides a fast evaluation of the semen quality. Like I said, it's a practical assessment of the sperm concentration and the overall motility, okay, without requiring any extensive time or specialized equipment. So that is the benefit of the wave motion test. It also has fertility correlation. So once we have a very high wave motion of a score of 4 or 5, you know that this person is unlikely to have any fertility issue. Okay, so you can correlate that one with fertility. All right, that's even if you don't want to do the semen analysis full profile. If you just want to have, like I've said, with the gold this thing. They go and then do sampling, and then straight away they know that, oh, this place, you don't need to go and do that. The sample is not anything to go by. Or you go and do the sample, say, hey, master, that place there, you don't have to joke with the place. Okay, so the wave motion score will give you a hazard correlation with the fertility. All right, and that is also very something. And what are the limitations? And because anything which is subjective cannot be reliable. Okay, because it's subjective. Somebody will say, oh, this one I give you a score of 1. Somebody will come here and say, oh, this one you should have a score of 3. There's no specific guidelines.
Opinion based.
Okay, people use experience. All right, so it depends on somebody's experience, but otherwise, because it's subjective, everybody can interpret it the way they like it, and that is a limitation of the test. And also like precision, because I know that for any quality testing, there should be accuracy and there should be precision. Precision is that if you do it 2 or 3 times, you should get the same result, and that's repeatability or reproducibility. All right. So because of its subjectivity, even the same person who examine it, if you want to examine it again, you may give different scores. Okay, then so it means that it lacks precision. All right. Especially as opposed to in the tail end, we're going to do CASA. CASA is computer assisted sperm analysis. We know that, and I'm sure that some of you end up somewhere in other developed countries where semen analysis is even automated. All right. And the automated method for semen analysis is the computer assisted sperm analysis, which is called CASA. So in those circumstances, everything, because it's computer generated, I mean, everything is specific. That's where they can talk about motility of 32%. But in our case, you can't get 32%. You're always making an estimate. All right. So in comparison to automated and advanced and accurate methods like the CASA, you see that the wave motion, which we are doing here, and I even doubt whether people do it at all. But if you want to do the wave motion test, it is nowhere close to its accuracy with respect to the CASA approach. All right. So thank you. So that is just for your appreciation. And I've said that it is not part of the parameters we use in our routine semen analysis, but it's good that for your understanding. And then if let's say, or you find yourself somewhere, somebody talking about sperm wave motion test, and you have done semen analysis or seminology with me, and somebody mentions this and say you have no idea. I think that would be an indictment on me, and so that's how come we introduce it. Not that it's part of traditional semen analysis. But what is actually of significance is the sperm motility assessment. But remember, we said that sperm motility assessment, the wave motion test is a characteristic of motility, because without motility, there will be no wave. There will be no wave, and if there's no wave, then there will be no wave motion. And if there's no wave motion, there will be no motion, a wave motion test. Okay, so it is a characteristic of sperm motility. All right, so it is not out of place, right? So we said that sperm motility is best evaluated within an hour of collection. You see that in our early stages, we said that we advise patients to, as much as possible, submit the sample, especially those that have been collected from the house, to try to submit them within 1 hour, because within 1 hour, a lot of things ought to be completed. For example, your pH should be done within 1 hour. Your sperm motility should be done within 1 hour. As time has effect on pH, and we did that extensively. So, and also time also has an effect on your sperm motility. And so, hello, please give me a break, 1 minute break. All right, sorry, I'm back. Motility assessment is one of the reasons why we ask patients to bring the samples as quickly as possible, because motility will vary based on the time of collection. So if you do motility after 1 hour, it will be different from motility test after 2 hours. It will be different there. So it is important that you take note that motility assessment is best evaluated. When I say best evaluated, it doesn't mean that if it is 1.5 hours, you can evaluate it. You can evaluate it, except that you have your doubt whether there has been some variation from the original one. Let me say this. There was a time when a patient was asked to go to a lab which runs night duty, and of course, the patient was supposed to go there to collect midnight blood sample. What tests will require midnight blood sampling? What tests or medications will require specimen collection around midnight? Hello? What tests will require midnight sampling blood? Hey, ladies and gentlemen, this one there is too fundamental, very, very basic. So you don't have to, you have to respond. What sample, what request or investigation will require midnight blood sampling? Joseph Yani, are you answering the question, or you are doing your own thing? Joseph Yani, I need an answer from you.
Grandpa, I think I've heard of cortisol said by a senior colleague.
Hey, cortisol.
Grandpa is testing for Victoria bankruptcy.
Yeah, filaria. You know why I'm bringing this one? I'm saying so because somebody was asked to go and collect a sample as midnight sample. And with the filaria, midnight sampling, the midnight is just that, like the apex or the optimal time, but the sampling can be collected between 10 p.m. to 2 a.m. 10 p.m. to 2 a.m. Just like when you say that afternoon should be between 2 to 7 days, but the optimal time is between 3 to 5 days. That doesn't mean that if the patient comes in 6 days, you say that, you should have come 5 days, and since it's the 6th day, it means you can't do it. You see that thing. So the patient went to a lab and he got there around 12:20 a.m. 12:20 a.m. means that, I mean, just around midnight. He gets there and then the lab person told him that, time napa. I say midnight, time napa. The patient has to go home. And then when you hear some of these things, you think it's a joke. It's no joke. The 12 midnight, the midnight sampling, yes, it's midnight, but like midnight, after 12, you can't do anything about it. So why am I saying this? I'm saying so because sometimes you say that, okay, the grandpa taught us that the sample should be done within 1 hour. So the sample comes in, let's say, in 1 hour, 20 minutes. Say no, we have to. You see, sometimes you also have to read and then also be circumspect and behave scientifically. That's just by the way. So with the sperm motility assessment, it is best. We are saying it best. That doesn't like, it can even be done after 2 hours, except that when you are reporting, you report that motility at 2 hours. Okay, motility at 2 hours, so that whoever is interpreting will know that, okay, then probably motility is low because of the time that the sample was assessed. All right, so it is also one of the parameters that display wide intra and inter-observer variations. Why are we saying so? We are saying so because if you are doing a count, you do it correctly, you go anywhere, the sample, I mean, it should be around the same thing. But where you have to, the motility assessment is also subjective, as we did with the wave motion test. Sperm motility test is also subjective. So even you yourself, okay, you can do it and do it again, then get a different interpretation. Or within the same lab, you do it, you ask somebody to come and do it, and then the person gives you a different results. So you can do it also in your lab. Somebody goes to do it in another lab, and then you get a different result. That's what we call the intra and inter observer variation. That is within your own lab, okay, you can have variations. And then you can also have from one person to another person, inter-observer variation. So a whole lot of variations can happen. You remember that we said that semen analysis has a lot of limitations. And that also included the high variabilities. Okay, and these are all aspects of it. All right. So, motility can be assessed in two ways. You have the quantitative motility, which will talk about the total and therefore the overall motility. Remember that when we're doing the wave motion, we talked about the wave giving you an indication of your motility. Okay, gives you an indication because you are seeing the wave to think that, okay, because the wave is strong, then you also have high motility. But that is not used to assess motility. So motility is now going to assess based on what you are seeing the sperm cells, seeing them move, and then trying to categorize it. All right. So you can do it two ways. Quantitatively, quantitative is just giving it a percentage. So as a percent is moving. But then you come to qualitative. Qualitative, we are going to now categorize them into where they are moving, to what extent. Yes, this is moving forward and fast. This is also moving forward, but very slow. This one is just lying at one point and then shaking the tail. This one is not moving at all. So that is the qualitative motility determination. All right. So there's also two ways. There are two ways to do the two things: the quantitative one and then the qualitative one. All right. Good. The quantitative. So you prepare a wet mount, not the wave motion one. The wave motion, remember we said that one you don't apply a coagulate. With the motility one, it can also be the same one that you use in your initial wet mount preparation. Remember we said that once you get a sample, you are also obliged to prepare an initial wet mount, which you have done extensively. Okay, that same one can be used to assess your motility. Okay, because we said that one can be used to assess motility. It can also have an idea, an estimate of the dilution to make. It can also be used to also find out whether there are some aggregates or mucus strands in there, and so forth and so on. All right, so that same slide can be used to do your motility, especially the one that we're going to talk about. So you don't need to say that, okay, I've done my initial listing, I'm going to do the motility. Let me also repand that slide. If you want to do that, fine. But you can still use the initial wet mount listing to do your motility assessment. All right. Now, how do you do that? Just normal slide prepared, examine under times 10, and then you scan the field and at least examine at least 10 fields. What it means is that you don't look at the field from one point and then do your reporting. I'm sure that's what some people do, but you don't do that. So you look at several, it's just like you're doing your urine deposit. You don't look at one field and do a report. You look at several fields, and then you have a fair idea about what you saw from the various fields, and then averagely do your reporting. So the same thing, you do a wet mount, you scan through the field, and then at least you look at about 10 different fields, and then you can have an idea about the motility, okay, compared to the sperm that are dead. And with motility, you are with the total motility, you are not considering whether it is moving fast or low or upward. For as long as there's movement. So in that case, you can look at the percentage of sperm that are dead in quote, because you are going to do the vitality test, which will tell you that there might be a cell which might be lying down, not moving, not doing anything. You will perceive it as dead, but it may not be dead. So you are going to do what you call vitality test. Vitality or viability by test to indicate whether the one which is lying there, whether it is actually dead or just like in coma. Okay, so we are going to do that. But on the face value, for your motility, you can assess those that are not moving at all, which are the dead ones, and then estimate their percentage. Then you subtract it from 100, because the whole thing should give you 100. And then motility here, you're talking about any kind of motion. With the total motility, it's any kind of motion, whether it's fast or low or small. So it means that the only thing which is odd one is the one which is actually not moving at all. So you look at the one which is not moving at all, and then estimate its proportion. And if it is from various fields, you see that, oh, majority of them are dead, in quote, are dead. Then you can also give an estimate. It means that about 60% of the sperm that you see on the field are dead. Then it means that 40% will be moving. As to whether they are moving forward or backwards, or that is immaterial. But we're talking about total motility is movement of any kind. Okay, movement of any kind. That's why I'm saying the easiest practical way is to look at those that are actually not moving at all, those that appear to be dead, and then give your estimation of that one and subtract from 100. Okay, and that will give you your total motility. All right, good. Now, in actual fact, normal sperm should have at least 40% of sperms moving within 1 hour. Okay, but within 1 hour, if you have some very good specimen, you can have almost all of them moving. That's from 80 to 100%, everything is moving. And that's very good motility. Yeah, you can also have 60 to 80% of them moving. And here you're talking about movement of any kind. It's also good. And then you can have, if you have 60 to more than 40% or some also moving, it's also normal. But if you want to look at the motility assessment or grading, then that one you say that it's only fair motility. But remember, we said that any normal sample should have at least 40% movement. So what it means that 40 is a pass mark. So, but with respect to 100%, 40 can only be a fair movement. That's what I'm saying. But you can have more than 80% also moving, then that's very good. You can have, let's say, more than 60% moving. That's also good. Then you can have more than 40% also good. So that more than 40% is still normal. Okay, this is what I want you to note. All right. So the baseline is annual crown, you should get 40%. Annual crown. But if you get 40% and somebody also gets 60%, they are all good, but you see that one is better. That's what we are talking about. Good. So we are done with the quantitative testing is very, very easy. Very easy. Look at your slide, look at several portions, at least one year by five fields. Then you have a fair idea about the movement. And each field you have to make your own assessment. And I'm saying that the practical quickest means is to look at those that are not moving at all and estimate your the percentage of that one and subtract from 100. That is the best approach and the easiest approach to get your total motility count. Then you come to the qualitative, right? When the thing is moving, then you are now going to assess what is the nature of the movement. And that is what people call the progression or progressive movement. So qualitative sperm motility assessment is a more specific measure of how fast or how straight the sperm is moving. Okay. So an actively motor sperm show forward progression motion of at least 25 micrometers per second. That is for theoretical purposes, but the movement is actually fast. All right. Then to evaluate the sperm progression, you place a drop of mixed undiluted specimen like we have said already, and to avoid the possibility of impact of temperature changes, it will be good that you pre-warm your slide. Okay, so you have a pre-warm slide, and then you apply a cover slip just as you've done already, and then you also examine this for more critically for the progressive assessment. Now you try to avoid looking at the edge of the cover slip. Remember, in the wave test, the wave motion test, we recommend that you look at the edge. But you see that one you put the drop there, and within a matter of few seconds you are examining it. All right. Here you apply the cover slip, and you're even advised to put the cover slip down. Sorry, you put the preparation down for about a minute before you examine your slide. What is the reason for not examining immediately after applying the cover slip? Who can tell me? When you are doing your motility assessment, it is advised that once you put on your cover slip, you allow the slide to lie down for about a minute before you examine. Why? Moses, this one there. Coach of, tell me.
I think to stabilize it and also to prevent current flow.
Sure, that's it. You are my man. That's why. So you are my consultant. When I have a problem, I'll come to you. So to avoid, anytime you prepare a fresh wet mount, there's a current flow. All right. So it has to stabilize, and then also, yeah, that's the first thing, stabilization of the slide, the current movement. Good. But if you allow it to stay for long, then that's also going to have a different problem where the slide will begin to dry up. And when it's drying up, it will start from the edge of the cover slip. Okay. And that can also create problem for you. All right. So avoid assessing areas close to the edge and at least not less than within 5 millimeter distance from the edge. Okay. So what are the categories? There are 4 categories. We have the 4, it can be considered as grade A or class A. Sometimes you also call it motility 4, even though it's A, but we have 4 grades. The last grade is motility 1. The second one is motility 2. Then so that the first one, which is class A, becomes motility 4. Right? We get there. But we have 4 grades. So some people can use grade A or class. So class A. Grade A or class A. Then grade B or class B. Grade C or class C. Grade D or class D. Grade A is for rapidly progressive motility. Those that are actually moving really fast. And we are going to take each of them one by one. And then we have the sluggish progressive movement. It is moving all right, going forward all right, but slow. Then there are none that are non-progressive. They are moving all right, but they are just staying on one side, one place, and then shaking the tail. And then there are some which are immotile. That's why I'm saying that when you're doing the total motility, look out for the D, those that are actually immotile. Because when you are looking at the total motility, grade A, grade D, grade C, they'll all be part of the total motility. So if they are part of the total motility, all you have to do is to look out for the D, those that are immotile. Those that are immotile, you subtract from your 100 and you get your total motility. All right. So for the grade A or class A or immotility, they are the rapidly progressive motility and refers to sperm that are moving actively and rapidly and very fast and forward to and linear, that is straight away. Or even if they will curve, they will go before they curve. So that's called large curves. Okay, large curves, circles or large curves. Okay. You have the grade B that are sluggish. So they are moving forward, but they don't go as fast as those in grade A. And then those that are going in the grade A1, they are almost going straight. So even if they will curve at all, they'll go far before they take a bend. So that's the large bend or large curve or large circle. But those that are not moving with a grade B, they are not moving fast, yet they have regular curves. So that is typical for grade B people. Then the grade C, that's the non-motile, refer to the fact that there's no forward movement. There's no forward movement. The sperms are stationary. They are at one side, and they're only shaking their tail. So we refer them to as on-the-spot movement. On-the-spot movement. Because meanwhile, you want the sperm to be able to move forward. You are moving. You can't say that you are dead. You are moving, but you are expected to be progressive forward, but they are not. But you can't say that they are also not, they are also dead. So they are part of the total motility. Okay, so that is also the grade C. And then grade D, which is the immotility, refers to no active tail movements. Remember that those that are not moving forward, but moving the tail, you can't say they are immotile. That is with the grade C. But with the grade D, nothing is happening. Nothing is happening. It is this stage where once you move forward, you are going to do the vitality. Vitality is about proving that it's dead or not. Okay, but for now, at this stage, you can only say that they are immotile, they are not moving. Now, so that is with the classification of the motility. Okay. So how to go about it practically? Within each field, all rapidly progressive protozoa, which is spermatozoa, which is a class A, and slowly progressive spermatozoa, which is a class B, are counted first. Okay. So remember that when we are doing the total motility, I said that the practical approach is that just count those that are dead in quote, that are immortal, and then that is very easy to get, and then you estimate the average. Sorry, you estimate their percentage, subtract from 100, and take that as your motility. That's the total motility, and now you come to the total motility, then you are going to categorize. If let's say your total motility is 80%, after the 80%, how many are showing class A or fast progression forward? How many are showing class B, which is progressively forward but slowly? How many of them are showing this? So in that case, don't tell me that, oh, grandpa, you said that we should do this one first. You do this one first to get your total. All right, that's the total motility. Once you have gotten the total motility, after the total motility, you are now going to subdivide them. So with the subdivision, now you look at those that are moving very, very fast. And also you estimate. These are all subjective. That is what you must remember. unless you are doing the CASA, the computerized system where it is a computer that's going to do the estimations. But this is manual, so the element of subjectivity comes in there. So now you look at a field, and then you, from the same field, you estimate how many of them are moving fast and forward, how many of them are moving fast forward but slow, how many of them are just one. You do that one, and then you don't take one field and do the reporting there. So you take several fields. Okay, so you count only cells that are present in the field. So within the field. Okay, but once you do that, you don't conclude from just one field. You go to other fields, and then now you can find an average movement of the classes of the sperms. And I'm hoping that it is something, once you practice, you should be able to do it properly. So a semen sample is considered normal when more than 40% of sperm are able to move. And when it comes to the grading, it's also normal when more than 32% are able to make forward progressive movement in the grades A and B categories. So, and you see that this is technically almost impossible because here the value is quoted from the automated systems, right? But when you are making an estimate, it is virtually almost impossible to get a value of 32. At best, you can get values in the range of 5s. So you can say 5%, 15%, 20, 25, 30, 35, and that. That one you can make that estimation. But to say 32 becomes almost practically impossible. All right, so take note of those things. Now, if greater than 60% cells are immotile, remember you said that if more than 40% are moving, you can say that they are normal. All right. Sorry again, my just a little. Okay, I think it's okay. You can. Sorry, back. We've said that if you have more than 40% of them showing movement, then you should consider this as normal. Right? What about if you have more than 60% of them showing immotility? If you have more than 60% showing immotility, that means that you have less than 40% also showing motility. Whenever this scenario happens, then you must go in for a proof check, and that is the viability test. Okay, so we are going to take you through the viability or vitality test, but it is not advisable. You don't need it for any test, for every test. Every test that passes the motility test, if you have more than 50% motile, 60% motile, you don't need the viability test. I hope that you are not confused. I'm saying that if you decide to do viability test for everything, for all your samples, fine, but it's not necessary. It's not necessary because you're using the viability test to check for those that are immotile to see whether they are dead or alive. All right. If that component is small, you don't need it because whether they are dead or alive will not affect the quality of the specimen. All right, good. And since you're on motility, we said that poor sperm motility is called actinozoospermia or actinospermia, but the rare this in actinozoospermia. I'm saying that sometimes people leave the zoo out, but it is the zoo which is talking about the sperms themselves, and the spermia is talking about the fluid itself. So if you leave out the zoo, then even though it's correct, then technically it could be problematic. So I advise that you should always find actinozoospermia. Good. Then we've mentioned about viability. So let's have a little talk about it. So I have some disturbances. I have my little grandson with me, and so sometimes seem to be asleep, but occasionally we just try to make it look as if he's waking up. Sorry for that interruption. So you said that once your sperm motility is showing high numbers of immotility, you have to do the viability test. Viability is also called a vitality. So vital is about life. Okay, so when you're talking about vitality, you're talking about those that have life. Okay, those that have life. So viability and vitality can be used interchangeably. So when you say viability test, it's the same thing as vitality test. Whichever way you go, it is the same. So you can have sperm that may be immotile, and we are defining immortality as those that are not moving, showing any movement at all. Now, if they are immotile, you may be tempted to say that they are dead, but they may also be alive, except that something has happened structurally that they cannot do anything about themselves. But you can't say that they are dead. All right. So as to whether they are dead or alive, then that brings in the element of the vitality test. Okay. All right. So sperm viability or vitality test determines if non-motile sperm are alive or dead. I hope that point is also clear. It can be determined routinely on all ejaculates. If you want to do it for every semen analysis, fine. But it is not necessary when at least 40% of the sperms are motile, just as I explained earlier. If you want to do it as part of everyday semen analysis, fine, for academic purposes. But it is virtually unnecessary if your sperm count, so your sperm motility test is high. You don't need it. Okay, it doesn't add anything to the result. All right. So in samples of poor motility, that is if immotile sperm exceeds 60%, the vitality test becomes clinically important to differentiate between the immotile dead sperm and immotile live sperm. And I hope you get that point clear. We are having a situation where our 60% are showing immotility. So therefore, at that point, it becomes clinically important to differentiate between those that are immotile and actually dead, and those that are immotile but also alive. Okay. So the presence of large proportion of life but immotile cells may be indicative of structural defects in the flagellum. Okay, so they're saying that once they are immotile, they are actually alive. If you do the test, you see that a lot of them that showed immotility are actually alive. Then it means that there was a problem with their flagellum. Okay, there was a defect, structural defect in the flagellum. Good. And I think this is also very simple to understand. A high percentage of immotile and dead, that they are immotile and actually they are dead, they may indicate epidermal pathology. Because remember that the cells were stored in the epididymis. Okay, they were stored in the epididymis before finally they were ejaculated. So if they come out actually dead, that means that something is wrong in the epididymis that could not keep them alive. All right. Or an immunological reaction due to an infection. If there's an infection somewhere there, then you know that once there's infection, there are a lot of the environment becomes very unfriendly and toxic. It can cause a lot of the sperms to be dead while they are being stored. And so once you release them, they are actually dead sperms, and then in that case, of course, you also will be accompanied by a lot of past cells. Okay, right. So we are doing the sperm viability or vitality testing. We said that this procedure is also not that You should be able to know how to do it, but it's not that you do it for every test. I think that you've said it severally. You don't do it for every test. But if for some reason you are getting low motility of a specimen, especially where total motility is not more than 40%. If total motility is not more than 40%, it means that immotility is greater than 60%. That one you have to find out. I've said this very, very well. Then it's a very simple test you have to do. Very, very simple test. You use EOC. I'm sure a lot of you know or use EOC. Okay, especially those who have histopathology or cytology. All of us know about H&E, hematology and EOC. EOC is one of the commonest, even if you are not doing histopathology. If it comes to the stock of reagents or stains that must be present in the lab, I'm sure you have EOC there. And even in hematology, I'm sure hematology people also use EOC. All right. So EOC, stain, very simple test. All right. So you do the EOC test. Now, the EOC test, as we move ahead along, has been modified to include a second stain. All right. But the routine, simple one will be the EOC test. And here it is a wet preparation. Take note, EOC test alone is used as a wet preparation. All right. So you have your EOC reagent. You take, and I'll take you through the procedure. You take a drop of the EOC and examine. Okay. And you're going to take you through how you're going to do it. But there's another modification where a stain called nigrosin has been added to the EOC. And that becomes nigrosin EOC test. So it is now recommended that you use EOC nigrosin. Now the EOC nigrosin here, the main stain doing the staining, the main stain doing the actual staining is the EOC. All right. So the nigrosin comes in as like a counter stain. You see, when you're doing gram stain, you have your what do you call it? You have your crystal violet as your primary stain. You go to the stain, and then finally you can use neutral red as your counter stain. So the neutral red will give you the background stain of a sort. Okay. So when you're talking, when the lab talk about counter stain, you're talking about a stain that is primarily gives the background staining of this of the preparation. So with the EOC, is the real deal. Nigrosin is added as a counter stain of a sort. So it gives you a background staining. Okay, gives you a background staining. All right. So with about testing, they use the nigrosin. Yanni.
Did you say a number that we should put you on?
All right. So with the when you come across EOC nigrosin testing, it's the same test. Here, nigrosin is being added to the EOC. And here, the nigrosin is playing the role of a counter stain to just give you a contrast, a background staining of the preparation, okay? So that you can easily, whenever you have a counter stain, it helps you to actually discern or...
Bless you. Give you long life.
All right. Can we move on? Can you hear me, please?
Yes,
okay,
Grandpa.
all right. All right. So I'm saying that with the EOC test, the nigrosin is added, and now EOC nigrosin become very popular. All right, but the actual deal or the principle of the stain, everything is based on the EOC. The nigrosin is just coming in as a counter stain to give you a background staining to have a contrast. Okay, all right. Now let's look at the principle of, so even though you have EOC